Hi, my name is Adriana English. I'm going to be your physician assistant student today. The purpose of this assessment is to examine your chest and cardiovascular exam today. So I will please have you take off your shoes, shirt, and socks for me at this time while I go and wash my hands. Thank you. Alrighty. I am inspecting her rate, rhythm, and effort of respirations, along with if there's any accessory muscle use or any signs of respiratory distress. In addition, I am inspecting her anterior-posterior diameter and making sure it's about half of her transverse diameter, approximately 1 to 2. And now that that is done, I'm going to ask for you to please turn this way, cross your arms in front of your chest, and I'm going to inspect your back. I'm going to palpate your lateral and posterior chest walls, looking for any tenderness or deformities. I'm going to palpate your thoracic expansion, looking for symmetry of respiratory effort. Can you please take a deep breath in for me? Out. Awesome. I'm now going to palpate for tactile phrepidus and compare the vibrations bilaterally. When I put my arms or my hands onto your back, I would like for you to say 99 for me, nice and slow. Okay.
99, 99, 99, 99.
Awesome. Okay, so now that I've palpated, I'm now going to percuss your posterior and lateral chest walls, comparing the sides bilaterally and listening for any resonance or dullness. Alright, now that I've done that, I'm now going to also take in the same exact spots that I did for percussion, but this time I would like for you to please inhale and exhale through your mouth for me. I'm going to listen to one full inhalation, exhalation at each of those points, listening for wheezes, bronchi, or rales. Okay, so each time, breathe in, out. Two more left. One more for me. All right, now that we have also taken your posterior back, I'm going to now have you lay down for me while I inspect your anterior. Sorry. So now I am going to inspect your anterior chest wall. I'm going to palpate for any tenderness or for any deformities. I'm going to palpate for thoracic expansion, looking for symmetry of respiratory effort. Can you take a deep breath in for me? Out. Awesome. And now I'm going to palpate for tactile phrepidus, noting the vibrations bilaterally. And when I place my hands on your chest, I would like for you to say 99 nice and slow for me.
99, 99, 99.
Awesome. All right, and now that I have done that, I'm going to move on to percussion. I'm going to percuss your anterior chest walls, noting any resonance or dullness, comparing the sides bilaterally. Lift this up for me. All right, and now that I have percussed, I'm going to now auscultate in those same exact areas, going to listen for one full cycle of inhalation and expiration, noting any sounds of bronchi, wheezes, or rales. So each time you feel my stethoscope go onto your chest, I would like for you to take a deep breath in and out for me. Okay? And one more. All right. And now that I have auscultated your anterior chest wall, we are now going to move on to your cardiac exam. So the bed is at 30 degrees, and now I'm going to now I'm going to use tangential lighting to look at your jugular veins and look for any distension or any pulsation. So if you can please look that way for me. All right, and then look at me. All right, and now that I've done that, I'm going to now auscultate your carotid arteries, noting any breweries if I hear them. And each time that you feel my stethoscope, I would like for you to take a deep breath in and hold it. And then you can let it out. And then I'm going to do the same thing on your opposite side, okay? So, deep breath in. Out. This way. Deep breath in. Hold it. Out. Right? Awesome. And now I am going to palpate your carotid arteries, noting rate, rhythm, and amplitude of each separately. Okay, this side. All right. And now I'm going to use tangential lighting again and going to inspect your precordium, noting any abnormal wall motion and your apical impulse. Right? Sounds good. And now that I've done that, I'm going to move on to palpating your precordium, feeling for any lifts, heaves, or thrills. So I'm going to palpate in the aortic, the pulmonic, the herbs, the tricuspid, and the mitral. And then I'm going to palpate for her point of maximal impulse, which is going to be 2 centimeters into her 5th intercostal space, and going from 4 to 3, then 2. Right? You feel it there. And now moving forward from that, I'm now going to also take her precordium in those 5 exact spots, listening to S1 and S2 while simultaneously palpating her carotid arteries. And I will also listen to S3 and S4, noting any gallops, rubs, or murmurs with the diaphragm of my stethoscope. Okay, so aortic, pulmonic, herbs, tricuspid, and mitral. And now I'm going to do the same exact thing, but I'm going to use the bell of my stethoscope. So mitral, tricuspid, herbs, pulmonic, and aortic. All right, everything looks good there. So now moving forward, I am now going to look at her, inspect her upper extremities, looking for any pallor, edema, cyanosis, or any symmetry. I'm also going to look at her capillary refill, looking for that her capillary refill is less than 2 seconds. And now I'm going to palpate her epitrochlear lymph nodes, looking for any enlargement or tenderness there. Just relax. All right, and now I'm looking at her posterior extremities, looking for any pallor, edema, asymmetry, or any cyanosis. I'm also going to look at her toes for any capillary refill and making sure it's less than 2 seconds. All right, I'm gonna go wash my hands again. Right, and now that I've done that, I'm going to palpate her inguinal lymph nodes. I'm going to palpate her vertical and horizontal groups, looking for any enlargement or tenderness there. Okay, and now that I've done that, I'm now going to palpate her arteries, looking for rate, rhythm, and amplitude and symmetry. So first I'm going to start off with the brachial. And then the radial, and both sides bilaterally. And then the femoral. I would do this underneath her clothing for both. And then I will also do your popliteal. I did not pull this out the whole entire time. So I would do that in the actual practical. So now I'm going to do her popliteal. Okay, so put this one down and relax. And I put this one up for me. All right, and now I'm going to do her posterior tibialis. And I will do her dorsalis pedis last, because I do not want to touch her feet again before I do her, I also take her arteries. So I'm going to palpate first her abdominal aorta. Okay, found it there. I'm going to now also take in that area with the bell of my diaphragm. Okay, I'm now going to do her renal. Her iliac. and her femoral, which I would do underneath her clothing. And then, now that that is done, I am going to palpate her dorsalis pedis and palpate her abdominal aorta
The size.
and the size of it and the size. And now I'm going to palpate her dorsalis pedis. Pulse. Okay.
We can do it again if you want.